Northern Life recently sat down with hospital executives to discuss the peer review conducted by Hamilton Health Sciences CEO Murray Martin.
That when he says HSN should be the leader, or take the leadership, implied in this is for us to work with our colleagues to ensure that all three of us providers adopt the same priorities. And if we do that, then it switches the focus to a common problem.
Yeah. One of the things he identified in there was was that, or what he said was a sort of a lack of coordination between those three main players.
Yes, that's why we're tightening our links.
Yeah.
With the CCEC and St. Joseph.
How are you accomplishing that? So it's a little bit more conducive to achieving the goals that
it takes a while.
set out before.
The comment is that Mr. Martin made in his report was that the philosophy on first needs to be, is it restarted or strengthened?
Yeah, relaunched or
relaunched.
Yeah.
So, and that's an issue of communication between the CCC, HSN, and our individual staff. And eventually Vivian and her colleague at CCEC will massage the message.
Yeah.
So that, because one of the problems is the culture that David was referring to of our staff. And this will require a huge shift. And that requires it starts with communication. Suppose that at the beginning, when we started that 2.5 years ago, we say, we're going to go home first. Where's the first patient? With the first patient. And then the second patient, there's no resource. At third patient, there's no resource. So what do you think is a natural tendency of a staff? Well, 2 out of 3 are not working. Why should we go forward? I mean, that's the perception of the staff.
Right.
Okay, so, and that leads to...
And is the perception right that there's not enough resources in Home First?
We're looking and sitting with the CCAC, reviewing all of our policies. We do have an escalation process. There needs to be the alignment of the family, right? So that's where the difficult conversations come in. And then, of course, the community resources. We need to make sure that the community resources are available, that we're not just taking care of low needs clients within our community service sector, that the cultural change around Home First within our community service sector might be, we're going to be managing very complex individuals within our community, and that's the expectation.
There are certain things that will need to be looked at, and one of them is access to private finances or private services. If that has not been done, then the whole work is not complete.
Right.
And before calling that patient's for LTC, it needs to be completed, and that requires a lot of discussions with either the patients
or the patient's family.
Or the patient's families.
To me, that almost seems like your biggest job is to alter people's perception of what the hospital is there for and what it provides to them and what their role is.
That is why we have to offer alternatives to the old concepts of beds. Let's face it, aging is not a disease, but it is accompanied by problems, and social isolation is one of them. And by providing that type of support, at least, we help. And David has started to work with Janet McNeil, our new geriatrician, in devising the concept of what we need to do after the beds are closed. But I think that's the future.
Yeah.